for example, in female hormones, we unintentionally realize that there's only 6 profiles. Women always fit into one of 6 buckets genetically, right? We didn't start off that way. We started with hundreds of women that we were studying, and then all of a sudden they always fit into one of 6. So now, first of all, the middle 2 don't need anything. They're optimal. The outside 2 both need a different dosage of the same thing, right? So the outside 2 on this side are more estrogen dominant, and these ones are more androgen dominant. So they kind of need the same thing, just more dose, the more extreme you are. So now we've gone from one product, one size fits all, which is failing 30 or 40% of people, to 6 profiles that really only need 2 products. So we can solve 100% of problems with 2 products. And that's true for most genetic systems.
That's beautiful work. No, because we, I mean, oftentimes when you listen to your patients, you wind up doing what I call pin the tail on the donkey, which is, try that. Oops, that didn't make me feel good. Okay, we'll try the other thing. Let estrogen. No, that didn't work. And we'll try more progesterone and more androgen. I mean, it's because the levels don't always tell you what to do. It's the genetics. That's wonderful.
A combination of 2 is great because the levels will tell you where you're at, and if something is off, the genetics will answer why.
Right.
You now know where to focus. And there's certain men who, we're in Toronto, which is the hub of hockey training for the NHL.
Right.
So we have all the best trainers here. Everybody flies here in the off season to train. And I can't tell you how many trainers have come to us saying that this guy doesn't recover. He's got testosterone issues, and we've tried everything and it just doesn't work. So what does try everything mean? We've seen men, NHL players, that come to us with gynomastia, man boobs.
Yeah.
Why? Because the guy's testosterone levels are low. So intuitively, what do you think? Give him some testosterone, right? So they put on an androgen gel pack. It's like a thing you put on your stomach where it absorbs through your skin androgens, testosterone. But in your genetic cascade, what if you're converting all the testosterone into estrogen?
Yep.
The more testosterone I give you, it's just going to net more estrogen. There's no way that becomes more testosterone. Yep. What you actually need to do is block the conversion. Right. So again, that comes back to the test will tell you in time what's wrong. This person doesn't have enough testosterone. How to fix it or why is the genetics. Here's where the guy is failing in biochemistry. So intervene at this location, not at this location.
Yeah, this is beautiful work. I mean, because it's just so good to hear that you're spending what excites me is that there are other companies out there that are looking at lots of studies and improving things, but you're doing the next step. You're looking at people.
Yes.
And the dirty, what nobody likes, the dirty information. You know what I mean? Like it's because it's not clean. It's not like it's not yes or no. It's like you got a group of people, and some of them respond a lot, some of them respond a little, and and that's beautiful that you've spent the time and money to get the AI to actually be useful. Because too much of the time, I've been, what can I say? I've been a doctor for a long time, and I remember when everything was going to be a virus. This was back in the 70s and 80s. Everything was going to be a virus. Okay, right. and then 2000 came, and everything was going to be a gene. And and all these things. Each one has information, but nothing has all of it. And even now, so many people are trying data mining and this and that. But unless you really spend the time and do the careful clinical evaluations, the data mining is garbage.
Yeah. That's right.
And that's just really exciting. I'm sorry, I'm going off into things that excite me, because this is the work, as an individual physician, you have your experience, and that's colored, and you forget, and it's just good to have people who are actually, putting this into systems, because that's when we can really share information and
that's when you can apply it. It becomes easy to use, first of all, because it's very challenging to be a practicing physician trying to incorporate genetics, because you're already so busy. You already only have 30 seconds to read the chart before you walk in the room, and now I have to go interpret a 300-page genetic report before I see this patient, right? How do you do that? So and they expect you to know it inside out.
And of course you can't, because the issue with genetics is that, first of all, nothing has a name that really means what it's supposed to mean. Actually, a few of them do. At least COMT kind of tells me what it does.
Yeah.
But most of the genes are gobbledygook, and
Yeah.
and so they don't really. You have to do levels of reading to get any information about it. That's what people have to understand. This is not a straightforward, read a paragraph and know what's going on.
Yeah, and that's a big part of the work we did. Was before launching anything, actually last year, so from January till June of last year, I probably spent time with about, I'd say 80 to 90 different physicians to ask them, why does genetics not work? Right? What's the problem? And most of it had to do with it being not easy to use. That was the majority of it, right? And a big part of it, so they didn't really know what the solution was, but they told us all the problems. And so what we believe the solution is, and what we've done now, is two things. First of all, the consumer, the patient, and the clinician don't need the same thing. They need very different things, right? The consumer is saying, give me everything. I've just given you my DNA. You go mine it and tell me everything you can find, right? And make it easy for me to understand.
Yeah.
The clinician is saying, I just need to know the red flags so I can fix them.
Yes.
Right?
Exactly.
That's what, and I need to know what to recommend, because if you're uniquely telling me what's wrong, meaning that you're looking at this condition from a unique perspective, then your solution is also going to be unique. It's not the symptom masking solution. So that's what we did. We built two separate reports. The consumer gets a more digital experience where they can drill through things and read and learn, and the clinician gets a very dry report that's straight to the point. Here's what's wrong. Here's what to recommend. Here's how you fix it, right? So that as you walk into the meeting, it's right there in your hand. So that was one. The second big thing that we learned, and this is again from talking to people, is we had to speak to the condition, right? People don't, again, like you said, what does this gene mean? Gobbledygook, it's all gibberish, versus anxiety, addiction, procrastination. Here's the human behaviors. Here's what people resonate with. Where do I rank in that stuff? And now I start to understand how my brain works, and I start to understand, how do I even perceive the problems that we're being talking about? When I say it's 7 out of 10, is it really 7 out of 10? When Dr. Gordon tells me something, can I actually comply? How do I deal with reward? So that level of insight, if I can just look up anxiety as opposed to 12 genes that might equal anxiety and trying to interpret, just so much easier. So that's what the key thing we learned was, it had to be easy to use. And that's done by splitting it up and then speaking to the condition.